just put it on, I was just looking, and all of a sudden there was a picture of the state minister standing talking, and Benny King standing up.
So what did you say?
By the time I would have thought, you know, said pull the TV on and find this channel. That's kind
Distinguished guests, ladies and gentlemen, welcome to this Global Conference on Community Health 2014. This opening session of this Global Conference will be chaired by Honorable Vice Chancellor, Bangabandhu Sheikh Mujib Medical University, Professor Pran Gopal Datta. We are honored that our today's session's chief guest, Mr. Janib Malik, Honorable State Minister, Minister of Health and Family Welfare, just given us the consent to start the program. He will be joining within 15 to half an hour time. So he has given us the consent to start the program. We have a special guest to prepare. Mrs. Roshana Kader, Additional Secretary, Public Health and WHO, Minister of Health and Family Welfare, Government of the People's Republic of Bangladesh. We have guest of honor with us, Mr. Carey Adams, CEO, Union for International Cancer Council and Chair, NCD Alliance. We have Dr. Joe Thomas, Executive Director, Partners for Population Development. We are very honored that this opening session, a keynote presentation should be given by Dr. Hossein Jilur Rahman, Chairman at Power and Participant Research Center, and all of you know he was our former advisor to the government in the last government. I am requesting Professor Pran Gopal Datta, allow me the guest, to be in the dais. Please, Pran Gopal Datta. I am also requesting Professor Hector Karaja from Partners for World Health, the organizers, one of the partners organizers of this conference, Professor Hector Karaja. Ladies and gentlemen, as all of you know, health, whenever talking about health, Mrs. Roxana. When we talk about health, we thought that health is a physical well-being, but the WHO has said no, it's not only the physical well-being, it's physical, mental, and social, as well as spiritual well-being of a human. So it's very important that the whole community where we live, the family where we live, has to be improved in the quality to get a sustainable changes in the health. So the theme of this global conference is sustaining change in community health. So, ladies and gentlemen, with this theme, we will be having our 3 days conference, and there will be around 100 papers will be there in all three paper sessions and panel sessions, and 950 participants participated for this conference. So with this, may I request Professor Hector Taraja to provide welcome speech. Mr. Taraja.
Good morning, everyone. My name is Professor Hector Terraza, and I'm from the United States of America. I have the distinct honor of welcoming everybody to the Global Conference on Community Health 2014. This year, we're going to be focusing on sustaining change in community health. But before I begin, I'd like to acknowledge 2 organizations who have done a tremendous amount of work to put together this conference for the 2nd time in a row. Partners for World Health is an NGO located in the United States of America whose focus is to bring medical groups to various countries to provide healthcare camps along with medical supplies. The organization Eminence is based here in Bangladesh, and their job is to promote social development. I'd like to acknowledge 2 individuals, the leaders of these 2 groups, to stand up and give them a round of applause. Elizabeth McClellan and Dr. Shameen, where are they? Thank you very much for your efforts. We really appreciate it. Last year at our conference, we focused on topics of innovation, technology, safety, as well as universal health care to improve the quality of clinical care here in Bangladesh. With new clinical innovations, we began to introduce these ideas into the bedside practice. I vividly remember several of those talks, being incredibly important. The talks on burns, the talks on ophthalmology, the talks on maternal and child health. And there, we were able to see all these new innovations that are being now put into bedside practice. The problem, though, is that when we introduce change, that only represents 25% of success. The other percent, the 75%, is actually sustaining the change. It's imperative that we not only introduce change, but we need to sustain it. In this day and age, as we finish the Millennium Development Goals, we're going to be asked to sustain those changes that have been introduced. And so, because of this, we have to figure out a lot about the science of sustainability. The science of sustainability does require accountability. It's imperative that each and every one is accountable for how we sustain changes in healthcare. Each and every one of us in this audience has a responsibility. I just wanted to go over very briefly what those responsibilities are. For the doctors and nurses in the audience, You must advocate on behalf of your patients at all times. You must continue to keep an open mind on how you care for patients. You can't just practice the same way over and over year after year. You have to work on innovations and you have to sustain them. And you must use your resources wisely. And I learned a really good lesson these past 2 weeks in our health camps about how wasteful we are as Americans and how resourceful you are with your resources in the operating theaters. For the public health officials, you must focus on improving the population health through sound policies. It's imperative that we introduce sound policies in an effort to sustain these changes. And you must measure these changes, but not keep them to yourself. You must share them with all of us at all times so that we as clinicians know how you're doing. For the scientists and researchers out there, you must conduct your work in an ethical manner. It's imperative that you do this ethically and soundly. You must focus on translating your good work into clinical practice so that we can benefit everyone. And translational medicine has become a very important part of how we do things. To the students, and I had an opportunity to meet several of the nursing students in the back of our audience, you represent our future, okay? You represent our hope. You must educate yourself. You must honor those who teach you, your professors, your colleagues, and you must commit yourself to success. Not part of the time, not most of the time, but all of the time. You must commit yourself to success. And finally, to the leaders, and I shared this picture of our Minister of Health here in Bangladesh, who was kind enough to receive us recently. And I speak on behalf of all the members of the panel here. We must commit ourselves to the good of each person's health. You must trust the doctors and nurses. These are the people who are out there on the front taking care of patients at all times. You need to trust them. As a leader, I need to trust my doctors and nurses. And finally, you must lead with nobility and integrity. Now, in this day and age, we hardly use those two terms, nobility and integrity. But that really is the character of healthcare, nobility and integrity. And whether you're a student, you're a doctor, you're a nurse, you're a public health official, you're a researcher, or you're a leader, you must carry yourselves out with nobility and integrity. And so throughout this conference, I'm going to ask each and every one of you to ask yourself the question, what can you do to help sustain change in healthcare? When we introduce those wonderful new ideas, those wonderful new concepts, what is it that you can do to help sustain this change in healthcare? Finally, I want to welcome everyone to our second Global Health Conference on Community Health. The American team who is here, we are all delighted to be a part of this conference, delighted to be part of your solution to your problems, and we are part of Bangladesh. Thank you very much.
Thank you, Professor Hector Daraja. Just for the information that we are very happy to learn that Professor Daraja and Elizabeth together, yes, is leading a team from USA, the Partners for World Health. And they are coming, this fourth time they are coming to Bangladesh, and not for only this conference. They are coming to provide training to our healthcare providers, to provide services to different district level. This year, they have already provided services in Sirajganj and Bangladesh in the last 2 weeks. So, ladies and gentlemen, now it is my privilege to invite Dr. Hossein Jilur Rahman to give keynote speech. May I request Dr. Hossein Jilur Rahman to give keynote speech, please.
Good morning. At the start, let me congratulate the organizers, particularly Partners for World Health and Eminence, and all their partners for this very timely conference. At the very outset, I should admit that I should not be here, because I am not a health sector specialist. My track record in health is very limited, very negligible. So I was wondering why on earth the organizers actually requested me to make a keynote speech to this conference. Besides their kindness, the other factor which I felt is that we are in a moment in which the importance of health has now to transcend the boundaries of the health sector itself. I'm by profession an economist, and we have felt that as economists also, it has now become imperative that health must become a priority of the priorities in today's world. Which is why I could then rationalize that there's some logic maybe for me to be standing here and try to speak to you. Certainly I think I don't deserve to be a keynote speaker, but I can share some thoughts as an outsider, as how we are seeing the importance of the work that this conference and other health sector professionals are doing, and how gradually there has to be a larger coalition of social forces who have to uphold these agendas of health, particularly community health. I think today's session or this conference has this theme of sustaining change. And I think that is relevant not just for health, for all of development agenda. This issue of sustaining change is very important, because we have in countries like ours or across the world, we have many initiatives are taken, many projects are undertaken, etc. But the key question at the end of the day, once the initiators have stopped their initial enthusiasm, does it survive? Does it survive the initial efforts of the initiators? So sustainability, I think, is the global term being discussed today around the world, not just in health sector. In fact, all sectors, sustainability has become a core issue. And therefore, I think it's right that sustaining change has been chosen as a theme for this global conference. And I think later we can discuss that it is very important for us to have an important conversation of what we mean by sustainability. We have to unpack this issue of sustainability. Where is sustainability really most effectively pursued? Obviously, the focus is on, today's focus is on community health. That's very important. There are multiple messages there. It can be read in many ways. Community health can be a field in its own right, but I would like to understand community health meaning health being ensured at the community level, meaning health being ensured at the level of the people in general. So that's how I would tend to understand. And I think I should also highlight that conferences like this have become important. Health is important, sustainability is important, because the global discussion is also, there is a particular moment. MDGs are going to transit to SDGs. Millennium Development Goals, the discussion on that is now they are going to transform themselves into sustainable development goals. Now the sustainable development goal is an aspiration. It's the new aspiration of the global community on the development field. Now that aspiration needs to be concretized, needs to have anchors in terms of ideas, programmatic ideas, knowledge ideas, etc., so that they again don't become just a slogan, that they are also, at the end of the day, they deliver the goods for which we are, this global discussion has been initiated. Now, let's think of what is it that we want to make sustainable. We are saying sustaining change. Certainly changes can be of many sorts, and I thought at least there are 4 dimensions to sustainability that we need to think about. One, of course, is at the level of capacity. you want to deliver services, etc., you must have capacity. So capacity is a very important dimension of services. Capacity does not necessarily mean only at the top. Capacity at that community level is also a very important issue. So that's one key element of sustainability that we must think about. The other, again, is very important. I think it's doubly important now that a country like USA and Bangladesh are facing a similar problem which would amaze us. For example, in USA, obesity is a very great problem. Even in Bangladesh, among these middle classes, etc., obesity of their children is becoming a concern. This obviously, as a health problem, it is a preventable problem. Preventable in the sense that it's an attitude issue. So sustainability also has to focus on attitudes. Attitudes which promote healthier lifestyles, attitudes which actually lessen the burden of the need for healthcare. Obesity being one prime example. So I think when we talk of sustainability, attitudes are a vital area where we have to address. And of course, then there is the actual delivery of services. That's a well understood area. How we make it sustainable, how we transit beyond pilot exercises and make sure that the infrastructure setups actually deliver services. Because Bangladesh, for example, has a, compared to a developing country, Bangladesh has a fairly reasonable health infrastructure, down to the village level, down to the human level, the community clinics, etc. But the important issue, of course, is the services coming out of this infrastructure. So that's the other area where the sustainability issue is very important. And the fourth, and this is where us as economists also come in as a necessary participant in this conversation, is that these have to be economically viable. You have to have, models, you have to have healthcare delivery systems which at the end of the day are economically viable. Meaning not that everything needs to be privatized, that's not the issue. Meaning the state itself also has to generate resources in a manner, or issues like health insurance, etc., which are not even, have any footprint in Bangladesh. Those will in the future will have to become part of the discussion. So economic viability, that's also a core issue on this sustainability agenda. Now, I think the other issue where it's an element of the sustainability issue, but I think let's discuss it in an independent manner, which is in terms of action on the ground. And I think a key focus of this conference is how to link knowledge and action, how to link evidence and action, so that at the end of the day, whatever initiatives are being undertaken are coming out of a proper understanding of the realities. And I think this challenge of linking evidence and action is also a core issue of this conference. And I think here, we also need to understand that linking evidence and action also has, we need to unpack that also. What are the elements there? For example, understanding need is very important. What are the needs that we want to address? I actually, as I said, I'm an economist, but I have become very interested in the health issue in recent times. It struck me, we have been, for example, focusing, Bangladesh has a very progressive social policy with regard to disability. We have a disability allowance system, we have some policies are also actually have been enacted by the government to address disability. But here the issue of need becomes important, because if you, and statistics of disability are a concern, from anything from 1 to 10% of the population are supposed to be suffering from one or other types of disability. But the importance of evidence here, let me highlight it in this manner, that when the social discussion about disability is like it is an issue for which care is needed. But a large part of the disability problem is actually a preventable problem, essentially around the issue of birth defects, which are correctable through surgery and other. If birth defects are addressed right at the time after birth, you can immediately, for example, halve the problem of disability in Bangladesh. Because much of this, the cleft lip, the foot which is turned around, etc., many of these are actually could become disability for the society because those sort of corrective steps were not taken earlier enough. Now, here is this question of need, actually understanding need properly. That if corrective surgery was elevated in a much more priority manner for the healthcare system, you would be simultaneously addressing a very important problem of disability. And in fact, halving perhaps the need for care down the line when people have grown up, when the corrective surgery possibilities are much limited. That's one example of how understanding the need is so important through proper research and etc. Then of course, linking evidence to action, I think very important the issue of packaging. How do you package the elements of a product that you are going to offer to the community? Packaging is not in the sense of applications, but in terms of how do you, particularly, in any area of healthcare, it's community healthcare or it's a capacity building program, etc. How do you package it well will determine whether it will be successful, whether it will be sustainable in the down the line, etc., etc. For example, if you're talking of capacity building, is, for example, distance learning for certain areas of capacity building. Is that the way to go about it? Those are issues that we need to think about when we think of linking evidence and action. So packaging is very important. Delivery, of course, itself is very important issue. For example, one might think that every village also perhaps deserves a full set of health professionals. In a country like Bangladesh, if you go to the health minister and say that we want to appoint a heart specialist also in each village, he will point towards the finance minister and say that, why don't you go to him and get me the money? And the finance minister will of course say that, no, I have many other uses for this money. Which means that delivery can be done in many sorts of ways. Specialist care, it is difficult to think of it being made available across the board, but it doesn't mean that specialist care cannot be taken to the community. You can have outreach programs of many sorts, but this specialist care can be actually also brought to bear on the problems at the grassroots level. So delivery models, I think, are issues in which the linking evidence and action becomes very important. Many of the weaknesses of the system, I find that's not unique to health. It's education, it's economic development, etc. Many of our programs do not have appropriate feedback mechanisms. Is it working on the ground? Where are the problems during the process? Where are the problems in terms of getting the input from the ultimate beneficiary? The feedback mechanisms, monitoring mechanisms, these are one of the great weaknesses of our delivery system. And I think, particularly in healthcare, it is so important to understand how are the feedback mechanisms best organized so that they continuously fertilize our understanding of what's working, what's not working, and how to improve the situation, which means that the process of delivery is continuous, the adaptation process, utilizing the feedback mechanism is actually used well. And therefore, let me come back to finally to the issue of sustainability, sustaining change, how we should understand. I initially understood, I mentioned dimensions of sustainability in terms of capacity, attitudes, delivery, and economic viability. But in terms of action, related to sustainability, what is it that we want to do. And I think, again, here, sustainability can come in various ways. And that's, as I said, again, it's not unique to the health sector. These are common challenges for any sector. One, for example, is if you are able to transfer the knowledge required to sustain a service into the community, that's one way of sustainability. That's how this community-based care for the disabled, that's what it was all about. It's a knowledge transfer issue, that people should not be dependent on the distant specialist, but some of that knowledge is transferred into the community. So the community, the people on the ground have at their doorstep, so the opportunity to take advantage of that specialty. So knowledge transfer. For example, we are trying to, as I said, we are a late entrant into the health agenda, but one of the things we are trying to initiate is a health insurance pilot for government workers in the Ghazipur area. And while we have been discussing many things, we were told that, the clients, meaning patients, they can go to a clinic, they can go to a doctor, etc. But in Bangladesh, the first line of defense on healthcare, particularly in rural areas, often is the pharmacy. Because Bangladesh has had a medicine revolution, pharmaceutical revolution, you have pharmacists all across Bangladesh, down to the grassroots. The person who sits in the pharmacy actually is a de facto doctor for the local community. Because the community, the guy on the ground actually comes to them that I am having this problem, give me something. They have become. Is improving their basic knowledge about some health issue, is that one way to improve knowledge transfer? These are just some stray ideas, may not be just the most important issue. Often we find, for example, that critical services lack one element for which those services don't take off. Anesthesis. Is that a very detailed specialization, or can you have a more limited specialization which you can also serve on the ground? So those are types of issues, knowledge transfer issues, we need to think about if sustaining change is to become a reality. The second point, of course, is economic viability. I think I cannot underscore that enough. Governments of any country do not have infinite resources. So these have to be, the economic viability issue have to be considered. Certainly government cannot just say that, I don't want to give to health, I have to give to bridges. Health is a right of the people, etc. But economic viability is a very important issue. And I think how we organize that will be key to sustaining change. And I think issues like risk pooling, issues like reducing health finance risks, these are directions in which one has to move in the future. Globally also, I think one has to move. The other issue is, of course, the importance, I think, when you talk of sustaining change, it is also important we use the word equality. Because sometimes governments, for example, may be motivated to give bigger budgets if demonstrated quality results on the ground are actually continuously produced. So what I call this buying policy, creating policy buying, is also a method of sustainability. Because you are not just asking for money, you are saying that this money is producing this result, which is the larger goal of the government or the state. And therefore, government, I found, examples where if quality changes on the ground are demonstratively produced, there is a greater propensity within policymakers to funnel resources there. So, winning policy buying, winning buying from the larger policy community through quality products, to quality delivery and quality care on the ground is also, I think, one key element is sustainability. And I think that's where the issue of quality cannot be divorced from the issue of sustaining change. It has to be discussed there. And I said that the very fourth issue is very important, and this conference, I guess, is an example of that. It is very important also to project what is being done in an effective manner, so that a larger community, a larger social, larger society not only understands, also stands behind you. I think this winning a larger social, not just the policy support, but the larger social support is also important, which is why projection of what you're doing, if it is convincing, is also very important. It's not just advertisement, it's a effective communication to rest of society that these things are happening, so that so let me conclude that if we are to sustain change, we have to think of appropriate models of knowledge transfer, so that the specialist doesn't have to be on the ground all the time. Not all areas, of course, are amenable to that. We have to think about economic viability, very important. We have to think about winning policy buy-in from the policy community. And lastly, we have to win support from the larger society by understanding and by projection, effective projection of what we are doing. I think that's all that I had to say as an outsider on this. And I wish this conference best of luck. And as I said, it's an agenda not just for the health professionals, it's an agenda today. And I'm myself convinced that in the coming decade, health will be far higher on the global agenda than it has been during the MDG phase. And it needs to be done. It has to be far higher. And to achieve that, scaling up of the health agenda, health professionals and those outside, us, economists and others, will have to do our part. Thank you.
Thank you, Dr. Hussain Zilur Rahman. I think Dr. Hussain Zilur Rahman does not need any introductions. So I didn't introduce him in that way. But there is no doubt that nowadays only healthcare providers are not accountable or even responsible for providing health. There are other players has to play their role to improve the quality and of course the sustainable healthcare for the community. That's why the role of economics is very important to fill up the gap between the challenges and the opportunities. So we need the economic directions to get the opportunities to overcome the challenges. So I am very glad that Dr. Zilur Rahman has given us a very right directions towards that issue. So ladies and gentlemen, and we are very happy that Dr. Magduma Nargis, Additional Secretary and Project Director, Ministry of Health and Welfare, comes with us as a special guest. Coming to the program, may I now request Dr. Joe Thomas, Executive Director, Partners and Corporations. Dr. Joe Thomas, please.
Good morning, everybody, particularly people on the diet. Let me begin with congratulating the organizers for hosting the second international conference on, I would say that broadly on health in Bangladesh, particularly sustaining the community health in Bangladesh. Partners in Population Development is an intergovernmental consortium of 26 countries. So I bring the feelings of 26 countries. And definitely the health-related issues of Bangladesh is a concern for the global community. And PPD, by default, we act as a Bangladesh government's or Bangladesh people's ambassador on health and population issues. So that way, we definitely articulate the deliberations and concerns of health in Bangladesh to other member countries of Partners in Population Development. The recent issue of Lancet, they called the health in Bangladesh as a miracle. And those who are familiar with the medical journal in general, and particularly Lancet, that's one of the most influential journals in the globe, probably read by about 600,000 people in a week. So when they're saying it's that the health in Bangladesh is a miracle, I think we should really look at it. And when we looked at the data and the number, and it's really a miracle in many ways. Number one, the amount of investment Bangladesh made for health, that is less than 3% of the GDP. And at the same time, Bangladesh significantly reduced maternal mortality, infant mortality, neonatal mortality, and also improved life expectancy, particularly men and women. That difference is exceptionally noticeable. And this all achieved not necessarily with a significant amount of financial allocation for health. That's an issue which we have to particularly take into consideration. And when I looked into the theme, there are 5 themes selected for this conference: health services, challenges for disease profile, nutrition, food safety and food security, health system, proximal determinants of health. I think these are all relevant and important aspects. In my brief presentation, I just want to make 5 observations. And that is based on the data what is coming from Bangladesh, and also in the context of health is increasingly becoming a kind of beyond the national boundaries. The health of each countries are influenced by discussions and issues and policies taken beyond the national boundaries. And Bangladesh also may have to take into that consideration. For example, the issues about access to treatment and diagnostic facilities. Most of the diagnostic instruments and tools or the protocols are manufactured or created outside the country. So probably we have to look at health in a much broader context. So this is the context in which I want to make 5 observations. Number 1 is about the changing epidemiological profile of disease in Bangladesh. And Bangladesh was traditionally known as one of the countries which is perennially impacted by a chronic infectious diseases. If you look at the epidemiological profile of Bangladesh, it's gradually shifting. Now almost 50% of the mortality is linked with non-communicable chronic diseases. That means we are shifting towards increasingly on what we call it as the developed countries phenomena of health. Bangladesh gradually moving towards that. I would say 50% of the epidemiological transition already moved towards the developed country, imitating the developed countries' health and epidemiological disease profile. So probably this is one of the important issues which in the context of sustainability. How are we going to deal with the future issues of non-communicable chronic diseases? Particularly the shift towards diabetes, cardiovascular diseases, hypertension, cancer, chronic pulmonary diseases, and in mental health. I'm just alerting that the number is telling us the time to look at this issue of the shift in epidemiology. And also probably we have to look at health in a much more broader context. And in that particularly I would like to emphasize the issue of violence and its impact on public health. When I looked at the data of violence and public health in Bangladesh, interestingly, domestic violence is becoming a chronic issue of, I would say, chronic disease in the country. The UNFPA study in Bangladesh says 80% of the married women reported that they suffered or they experienced domestic violence. But we don't have any data to look at what is the health implication of those violence. But broadly, I would say that I would utilize this opportunity to highlight Bangladesh Sustainable Health has to look at the issue of impact of violence on public health and what is this the burden of disease, how it's contributing towards overall burden of disease. And the next point I want to look at the issue of, and unfortunately, the quality of care we provide in our hospitals need to be carefully looked into that. If we looked at some of the data on hospital-acquired infection in this country, and I must say that we looked at many other factors, and interestingly or very disturbingly, those who are familiar with the disease fistula, I've been told that 20% of the fistula cases are linked with the quality of care or hospital care acquired infection or phenomena. So this particularly, I'm not getting into other diseases which are linked with the quality of care, and I'm not denying that Bangladesh acquired tremendous success in the area of service delivery, but there is the sustainability point of view probably we have to look at the issue of how we are going to improve the quality of care, how we are going to ensure that the care we are providing hospital is at least a minimum standard, and at least when you go to the hospital, they should not come out with another disease. So I would say that is another important factor. And the other important factor I want to say that the resource allocation for health in Bangladesh. If you look at the national budget, the Bangladesh healthcare allocation is never more than 3% of the GDP. And the thumb rule is that unless it goes to two digits, so maybe 8, 9, 10% of the GDP, we may not be able to sustain the health benefits we acquire. We know that we have health benefit in the area of maternal mortality reduction, infant mortality reduction, neonatal mortality reduction. But to sustain this, probably we also have to make sure that the investment in health also has to go up. And I would say that, and many people say that, okay, in our neighboring countries, the investment is not more than 3% of the GDP. Probably that should not be the case. At least if you look at one country, neighboring country, Sri Lanka, and the comparable level of healthcare, they go up to 7%. But whereas India is again 1.2%, whereas Pakistan is 1.2%. I'm just giving some random neighboring country statistics. Sustainability point of view, Bangladesh has to look at the issue of resource allocation. Unless the resource allocation crosses more than a single digit of the GDP, we may not be able to sustain. Policymakers, I hope they will take this into consideration. And most importantly, as a concluding statement, I want to say that Bangladesh achievement in the area of health is a miracle. But can we sustain the miracle? And definitely we can sustain the miracle, provided number one, we'll ensure better resource allocation. We'll ensure that provided we have better quality of care, and also we look at the issue of how the policies are made in this country. And most importantly, I would conclude to say that we're looking at the linking of the data and the evidence and towards an ongoing policy dialogue. And Bangladesh being a part of the global community and playing a global sustainable role in the issue of ongoing dialogue in the area of health. And I wish the conference organization all the best. And I hope the policies and deliberation of this conference will be articulated and taken into consideration and presented to the policy making the bodies of the government of Bangladesh. Thank you very much.
Thank you, Dr. Joe Thomas. The community involvement in the healthcare should be one of the very prime issue that we need to address so that really we can mobilize resources. Because it's not only the provider's responsibility or the public's responsibility to mobilize the resources, but community should be involved in mobilizing the resources for sustainability of the healthcare. The achievement that we have done in the last 1 to 2 decades, reducing the indicators of the healthcare, of course, needs to be sustained, but I agree with Dr. Thomas that for sustainability, we need to have increased resources, otherwise it will be challenging again. So now, ladies and gentlemen, we are very happy that we have a guest of honor today who has come across from abroad to attend this conference. He is the chair of the Non-Communicable Disease Alliance and the chief executive officer of the Union of the International Cancer Control, Mr. Cary Adams. May I request Mr. Cary Adams to say a few words?
Good morning, everyone. I would just like to say that I landed on a plane 3 hours ago, and I've come straight here. So forgive me if I'm not working all 4 cylinders as I normally am, but it's a pleasure to be here. And I'd like to thank the organisers for arranging such a wonderful 3 days. And I hope it achieves exactly what we've set out to do, which is to define what sustainable change is and how it will impact the lives of people in Bangladesh over the many years to come. This afternoon I'll be doing a presentation on what is happening at the United Nations at the moment with regard to the issue of the replacement of the Millennium Development Goals. And I will cover in detail where we are on that process next steps are, and how it is important to everyone in this room and everyone in every room discussing a health issue, what will happen over the next 20 or 30 years. We are at a pivotal point in health on the global stage. Since the beginning of the century, communicable diseases have enjoyed the profile that they deservedly required in order to get them addressed around the world. And the MDGs have achieved much to put health on the agenda. Only a couple of years ago, 2011, I was privileged to attend the UN meeting which discussed the NCD issue. And through that process and the subsequent 3 years that's taken place, working with the World Health Organization, we now come to a point where we have a global target for NCDs to reduce premature deaths by 25% by 2025. We have 9 targets which cover the risk factors of the availability of essential medicine drugs around the world. And at last World Health Assembly last year, we signed off a global NCD action plan, which all member states signed up to, including Bangladesh, which committed all countries around the world to put in place national NCD plans, working together with the four key diseases: heart disease, diabetes, cancer, and mental health and lung disease, and ensuring that every country reports back on a regular basis to say that they are doing what they said they will do. In the spirit of sustainable change, I firmly agree with the previous speaker that we need to put in place measurements and follow-up. And we are in a position now that we've never been before where we can actually say what we want to achieve by 2025. We put in place a measurement system. We now have an action plan. And in July this year, the member states will go back to New York at the UN meeting on NCDs to just check to see where we are today compared to where we were in 2011. And I think we'll be reporting much progress. Much progress at a diplomatic level and certainly a government level, but I don't think we've fully seen the impact that those decisions taken at the United Nations and the World Health Organization and the World Health Assembly have had on the ground. Because as the previous speaker spoke so eloquently, the amount of funds available for NCDs, which is my particular interest, have hardly changed in the last 4 years. And until we get a significant shift in the way in which funds globally are allocated to NCDs in balance with communicable diseases, then I believe we are not going to achieve the sustainable change outlined so eloquently in the papers for this conference. I won't speak too much about that. I'll just talk very briefly about the NCD Alliance and the UICC, the organisation which I head. We are both international organisations spread across over 150 countries, and we embrace organisations like Eminence and others, and hopefully give them a voice at the highest level in the political discussions on cancer, NCDs, and other health issues. But at the same time, we recognise that we have to give impact at a local level. And both the organisations I'm involved with will spend the next 4 to 5 years working out how we can embrace best practice from around the world, innovative, cost-effective, cost-justified interventions which will make a difference to people with NCDs, which will make a difference to health systems which may be skewed towards communicable diseases, but can be built upon to provide NCD support and services. That will be the action over the next 5 years. I wish you the best of luck over the next few days. I hope that we will get some meaningful actions from this meeting. Again, I agree that all of us have, without our own capacity, the ability to make a difference, both at local, regional and international level. And I assure you that both my organisations, which I operate in, will provide the support required for you to do what you need to do within your own countries. Thank you very much.
Thank you, Mr. Kerry Adams. Bangladesh is having in our party this both communicable disease. So there is no doubt that the changes in the pattern of diseases and non-communicable diseases coming more than the overcoming the communicable diseases. But for the sustainability, we have to address non-communicable diseases features that now we are addressing. So we need a lot of interventions in really overcoming these non-communicable diseases. I thank Mr. Kerry Sadir, External Secretary, Ministry of Health and Family Welfare, Government of Bangladesh, to give his as special guest. Mr. Roshana Khalid, please.
Honorable Chair, respected keynote speaker, respected guest of honor, distinguished ladies and gentlemen, participants from home and abroad. Good morning to all of you. This is my immense pleasure to be part of Global Conference on Community Health 2014. This conference focuses on dialogues to build an efficient system for delivering proper health services. I want to congratulate organizers, eminence, and partners for work for facilitating such event. Ladies and gentlemen, Bangladesh has made remarkable progress in health sector and has been recognized by UN bodies, bilateral donors, and international researchers that the progress of Bangladesh in health sector is huge. We have reduced child and maternal mortality, controlled communicable disease, reduced malnutrition. We are on track to achieve MDGs. Government policies and programs is not only health, but in different sectors like economy, education, women empowerment, social protection, as well as contribution of NGOs, academics, private sectors, and people's participation has contributed in the achievement of health sector. We have made 18,000 community clinics functional, and each community clinic is catering primary health care to 6,000 population.